Your doctor is going to prescribe Tamiflu. You probably already know it exists, but here's what they might not tell you, and it could change everything about how you experience flu this season. There's a medication that works faster, requires just 1 dose instead of 10, causes fewer side effects, and dramatically reduces how much you spread the virus to your family. Most Americans have never even heard of it, and most doctors aren't even talking about it yet. I'm Dr. Zaid Fadul, and this year's flu season is the worst I've seen in 25 years. Over 15 million people are sick, 180,000 have been hospitalized, more than 7,400 have died. Pregnant women, young kids, elderly parents, nobody's safe this year. But here's the thing, understanding your treatment options isn't just helpful. In a season like this, it could literally be the difference between recovering at home and spending a week in the hospital. Stay with me for the next 10 minutes, and I'm going to show you exactly how these 2 medications work differently, which one might be better for your situation, and why one has become medicine's best kept secret. Okay, let's dive in. To understand why Xofluza is such a breakthrough, you have to understand what's actually happening inside your body when the flu virus hijacks your cells. When the influenza virus invades your body, it's like a factory takeover. The virus breaks into your cell, commandeers all your cellular machinery, and basically says, stop making normal proteins, start making me. Make thousands of copies of me. Your symptoms, the fever, the body aches, that crushing fatigue, they're coming from 2 places. The viral invasion itself and your immune system fighting back to try and stop it. Now here's where these 2 drugs approach the problem completely differently. Tamiflu has been around since 1999. It's a neuraminidase inhibitor, and that mouthful of a word basically means it works at the end of the viral production line. Think of it like this. Inside your infected cells, the virus has already made thousands of copies of itself. It's ready to break out and infect new cells. Neuraminidase is the enzyme that helps those new viral particles escape. Tamiflu blocks that enzyme, essentially locking those new viruses inside the cell they were made in, preventing them from spreading further. It works, but there's a problem with this approach, and Xofluza solves it. Xofluza works completely differently. Instead of stopping viruses after they're made, it stops them from being made in the first place. It targets something called PA endonuclease, an enzyme the virus absolutely needs to replicate. Here's where it gets fascinating. The influenza virus uses a trick called cap snatching. It literally steals genetic code from your cells to make new copies of itself. Xofluza blocks this cap snatching process before replication even begins. So Tamiflu is like locking the factory doors after the products are made. Xofluza is like shutting down the assembly line itself. Both work, but one stops the problem at the source, and the difference creates some serious advantages, which is exactly what we're about to get into. Look, Tamiflu works. Let's not pretend it doesn't. When started within 48 hours of your first symptoms, it reduces how long the flu knocks you down by about 2 days. That matters. Standard dosing is twice a day for 5 days. That's 10 doses total. It's approved for literally anyone from newborns who are just 2 weeks old all the way through elderly patients. Because it's now generic, you can get an entire course for under $30 without insurance. For pregnant women, for mothers who are breastfeeding, for children under 5 years old, and for hospitalized patients, Tamiflu is the preferred choice. We have 25 years of safety data. We know it works in these groups. But here's what they don't always tell you about Tamiflu. The nausea and vomiting are real. In clinical trials, 10% of adults experience nausea, 8% of adults, and 16% of children have vomiting. When you're already lying in bed with a 103-degree fever, body aches, and a pounding headache, the last thing you want is medication that makes you feel more nauseous. I know my patients always complain about it whenever I give them Tamiflu. Taking it with food does help, but it doesn't eliminate the problem. Plus, there's the adherence problem. You have to remember, twice daily doses for 5 days. Miss one, and you might reduce the effectiveness. For parents trying to manage sick kids, for elderly patients juggling multiple medications, that 10-day regimen is generally hard to complete. Now, let's talk about why infectious disease experts are calling Xofluza a game changer. It was FDA approved in 2018, but it remains drastically underused. Some estimates suggest Xofluza prescriptions are only 5 to 10% of Tamiflu prescriptions. That needs to flip. 1 single dose, 1 pill, 1 time. That's it, done. No pill organizers, no setting phone alarms to remember dose number 5, no worrying whether you have enough doses to finish the course. The dose is based on your weight. If you weigh between 44 and 176 pounds, you take 1 40 milligram tablet. If you weigh more than 176, you take 1 80 milligram tablet. You take it within 48 hours of your first symptoms, ideally as soon as possible, and that's literally it. But here's where it gets interesting. Speed. A real-world study tracking over 500 patients found something striking. People taking Xofluza had their symptoms completely resolved in about a day. People taking Tamiflu, 48 hours. That's a full day of your life back. Their fevers broke in 18 hours versus 30 hours for Tamiflu. While both medications reduce symptom duration by about a day compared to nothing, Xofluza gets you back on your feet noticeably faster. But honestly, the speed advantage is not even the biggest reason doctors should be prescribing this. Transmission reduction is the game changer. Because Xofluza stops viral replication so early, it shuts down viral shedding, the amount of virus you're spreading, much faster than Tamiflu. While Tamiflu reduces viral shedding in about 3 days, Xofluza does it in 1 day. If you have kids at home, if you have elderly parents, if you have anyone immunocompromised, anyone you're worried about infecting, this matters enormously. Xofluza actually has fewer side effects than Tamiflu too. The most common side effects, it's mild stuff. Diarrhea in about 3% of patients, nausea in about 2%, headache in about 1%. Compare that to Tamiflu's 10% nausea rate and 8% vomiting rate. You can see why patients tolerate Xofluza so much better. And in real-world healthcare data from over 75,000 patients, hospitalization rates less than 1% for Xofluza users versus 5% for Tamiflu users. That's a dramatic difference. It suggests Xofluza might be genuinely better at preventing the serious complications we worry about most. And that brings us to something that's equally important as treatment. I need to tell you something that applies to both medications, and it's critical. Timing is absolutely everything. Both Tamiflu and Xofluza work best when started within 48 hours of your first symptoms. And more than that, the earlier the better. Here's what most people get wrong about the flu. It doesn't creep up. One day you're fine, the next day you wake up, bam, with a 102-degree fever, crushing body aches, severe fatigue, and a dry cough. It hits like Thor's hammer. That's when your 48-hour clock really starts ticking. If you wait 3 or 4 days hoping you'll turn a corner on your own, you've missed the window where these meds work best. This isn't the time to be a hero. Here's the good news. We have at-home flu tests at almost every pharmacy now. If you wake up thinking, this might be the flu, test yourself immediately. At Bespoke Concierge MD, we offer same-day telehealth visits where you can get a prescription without leaving your house. And with same-day delivery through Amazon Pharmacy and Cost Plus Drugs, you can literally go from, I think I have the flu, to medication in my hand within hours. For anyone over 65, pregnant women, young children under 5, and anyone with chronic conditions like asthma, diabetes, or heart disease, don't try to wait it out. Contact your doctor immediately. You're in a high-risk group, and antivirals aren't optional for you. Even if you pass the 48-hour mark, treatment can still help, especially if you're high risk or if your symptoms are getting steadily worse instead of better. Recent research shows hospitalized flu patients benefit from antivirals even when started several days in. But let's talk about something else that's changed the conversation completely. For years, cost was the main reason Xofluza wasn't being prescribed. When it first launched, a single dose cost $150 to $200 without insurance. Tamiflu, under $30 for the whole course. That situation just changed. And most doctors don't even know about it yet. In October 2025, the manufacturer launched a direct-to-patient program offering Xofluza for just $50 cash pay. That's a 70% discount from the list price. You can get this through Mark Cuban's Cost Plus Drugs with same-day delivery available in most areas. Plus, there's an enhanced coupon program that can bring your out-of-pocket cost down to as little as $35, with up to $70 off if you have insurance. Cost is no longer the barrier it once was. At $50 cash pay or $35 with a coupon, Xofluza is now competitively priced with generic Tamiflu. And when you factor in the single dose convenience, faster symptom relief, reduced transmission to family members, and fewer side effects, it becomes an extremely compelling option for most healthy adults and children over 5. Now, for my practice, when I have patients who travel, we send them with at-home test kits and a couple doses of Xofluza to cover themselves and their spouses and family members while they're traveling. There's no sense in not having it available just as an extra insurance when you're traveling. So how do you choose between them? Here's a framework. Choose Tamiflu if you're pregnant or breastfeeding, a child under 5 years old, hospitalized with severe or complicated flu, severely immunocompromised, or have significant kidney or liver disease. These groups have the most extensive safety data with Tamiflu and remains the evidence-based first choice. Choose Xofluza if you're an otherwise healthy person aged 5 or older, someone who struggles remembering to take multiple doses, someone who experienced severe nausea vomiting with Tamiflu before, or someone living with vulnerable family members you want to protect from spreading the virus. Or even looking just for the fastest possible symptom relief. Both medications are equally effective at shortening flu duration by about a day. Both work best within 48 hours. Both are safe and well tolerated in the appropriate patient populations. The difference comes down to convenience, side effect profiles, transmission reduction, and your specific health situation. There's no wrong choice, just a choice that's right for you. Let's bring this together. The flu isn't just an annoying winter illness. This year, it's a serious public health threat. And we finally have two effective options that work in different ways. Tamiflu, the tried and true medication with decades of safety data. Xofluza, the newer single-dose option that works faster and reduces household transmission dramatically. But here's what really matters. Most people aren't getting either one because they don't know they have options. They think they have to just tough it out. You don't. Your health is too important to leave to chance or outdated information. If you're dealing with flu symptoms, need personalized guidance on which treatment is right for your situation, or want a healthcare partner who stays current on the latest evidence-based options, you're welcome to join Bespoke Concierge MD. We're available nationwide, offering personalized care that treats you as an individual, not a number. From comprehensive evaluation to evidence-based treatment plans to one-on-one support when you're sick, we make healthcare simple, science-backed, and sustainable. Whether you're looking to navigate this flu season safely, optimize your preventive care, or finally have a doctor who explains your options thoroughly instead of just handing you a prescription, we're here to guide you every step of the way. Don't waste another day wondering what's best for you. Take action and get the personalized care you deserve. Remember, knowledge is power, and your health is worth fighting for. Stay safe. Get your flu shot if you haven't already, wash your hands, and know that if the flu does strike, you have effective options to fight back. If you're not sure where to get treated, the video on the right describes our virtual urgent care program. We're available nationwide. The playlist on the left covers influenza and related issues in detail. And hit subscribe. I publish evidence-based medical content every week that could change your life. Thanks for watching. If this information helped you or someone you know, please share this video. Your comment below could help others realize they have more options than they thought.